Bismillahirrahmanirrahim. Assalamu alaikum students. Today we will be very briefly reviewing about disorders of thyroid gland. Students, first of all, goiter. Any enlargement of the thyroid gland is called goiter. It may be euthyroid, means thyroid is functionally normal, only it is enlarged. This is called goiter. Second disorder is hypothyroidism. The thyroid is functioning underactively. And third one is hyperthyroidism. That is, the thyroid gland is functioning overactively. Students, in hypothyroidism, we have underactive thyroid gland. Example is Hashimoto's thyroiditis. It is an autoimmune disease in which antibodies are produced which block the TSH receptors on the follicular cells in thyroid gland. Most common cause of hypothyroidism is iodine deficiency. It is much more common in our society. Students, the other causes of hypothyroidism include cretinism. Cretinism is congenitally hypothyroid. That is, by birth, the thyroid gland is functioning underactively. And next is myxedema. In myxedema, we have generalized edema of the whole body because of underactive metabolism. And this underactive metabolism, students, is because of hypothyroidism. Next, we have hyperthyroidism. In hyperthyroidism, students, we have overactive thyroid gland. The thyroid gland is functionally overactive. The example is Graves' disease. In Graves' disease, it is an autoimmune disease. We have antibodies which are produced against the receptors which stimulate the TSH production. Or we can say that TSH receptors are stimulated. Students, other causes include thyrotoxicosis. In this condition, also thyroid is functioning overactively. Next is thyroid storm. Now, how to differentiate between hypothyroidism and hyperthyroidism? When we go for thyroid function test, students, in hypothyroidism, TSH levels is always higher. TSH level, thyroid stimulating hormone level, is higher in hypothyroidism, whereas it is lower side in hyperthyroidism. Subsequently, we have decreased production of T3 and T4 hormones in hypothyroidism. On the other hand, we have increased production of T3 and T4 hormones in hyperthyroidism. Okay, students, please take a brief look of this written material so that you can guide. This is disorders of thyroid gland. Goiter. Any enlargement of thyroid gland is called goiter. Thyroid may be functionally normal, euthyroid, overactive, hyperthyroid, or hypothyroid, underactive, and last one, thyroid malignancy. Hypothyroidism, underactive thyroid gland. Example is Hashimoto's thyroiditis. It is an autoimmune disease. Next cause, iodine deficiency. Then cretinism, it is a congenital hypothyroidism. Mixed edema, generalized edema of the whole body. We have increased TSH levels and low T3 T4 levels. Next we have hyperthyroidism. We have overactive thyroid gland. Graves' disease is an example, which is an autoimmune condition where antibodies are produced which stimulate TSH receptors. Other examples, thyrotoxicosis and thyroid storm. There is abrupt release of T3 T4 hormones in the blood circulation. This is called thyroid storm. We have decreased TSH hormone and increased T3 T4 hormones. Thank you students. Allah Hafiz.